Dr. Jenzer, how we doing, man?
I'm great. How are you, Brendan?
Great, great. Thanks again for coming on. I know this is like short notice within 5 days, but we're doing it finally.
Absolutely, man. Just honored and happy to be here.
And thanks for coming on Sunday as well, helping out with the study group. I want to
Yeah.
make sure you know how much that means to me, and but also helps the group too.
Thanks, man. No, yeah, it's I as you probably got the impression, the what motivates me is and frankly, a lot of the folks that you and I have interacted with is helping the next generation get through this task. So this is the last couple of weeks have been the start of that, and then last year I think in December and January, I was on people's mock calls about 5 nights a week. So I'm not sure I can do that with a kid anymore, but definitely at least once a week, just trying to help pay it forward. Because if we all do that, and, I know you will, once you pass the exam, help out for a few years, and then everybody wins. So, if we could propagate that message, I feel like we're just doing good for the world.
I really appreciate that so much. I wish that's exactly how it works. I wish everyone had that mindset. That's what I'm trying to say.
Yeah.
And no, that's excellent. It's funny. I gave you a shout out on a random. Sometimes I do these recordings, but then I'll post them to the podcast where I just go on rants or whatever. It's funny. But I mentioned you in there one because I was like, dude, your background is just incredible. And then what you're doing every day, you're signing on to these things. I mean, you have a daughter at home who's just born a couple months ago. You were at the LSU course. You're going to be at Nashville, right?
Not Nashville. No.
You're not going to be in Nashville, but you were at LSU, you were at North Carolina, you were at St. Louis, and then you have your other course in January. I mean, oh my God, this was another thing. You were up at 4 a.m. that last day in North Carolina. What are we doing up at 4 a.m.? I've been wanting to ask you this for since that day.
Stay on the grind, right? I think one of the things that kind of made it easier for me was, like most people, right? And when I'm speaking with externs or my residents, I try to encourage that passion and fire, because I think that is the most important quality in a resident or somebody in our profession, because as you know, it's a grind, right?
Yeah.
I feel like somebody who's reasonably intelligent can succeed if they have an amazing work ethics. I just kept that going after residency, going right into teaching and trying to do a lot of publishing out of the jump. And it was easy because my wife and I were living apart. She was still in residency. So it was easy. I just wanted to operate as much as I could and publish and, rock and roll. So.
And you did it.
Yeah. Well, it feels like I'm starting to get there, but definitely, I don't think you ever lose the imposter syndrome. I definitely still feel that, I think most folks do. And, I feel like I'm starting to get to a place where I have good things to teach and say, but, working with like the St. Louis crew, right? With, legends like Damian Finley and Reddy and Figgy. So, I feel like I've been riding those guys' coattails for a few years.
Stop. Really? Really? You are a plethora of knowledge and just, you are incredibly humble too. I think the imposter syndrome brings us all back down to earth. But dude, like at these events, I mean, I was able to hang out with you in person and you're just so easy to talk to. And I encourage other people to go up and talk to you. I was like, you got to meet Dr. Jenzer. Go up and say hello. He's absolutely brilliant, hard worker, program direct, like got a new kit. Oh my God. Just so
Thanks,
I've been pushing that a lot. That St. Louis crew, I'm going to put the St. Louis thing on this. I got to see if I can put North Carolina's as well to give some exposure for the course. And that's where we finally got to meet for the first time. That crew is a good group of guys and girls.
Yeah. I mean, and, you were there but we like to, Dr. Rashad Sheikh, one of our guys, he talks about it in his lecture, but he's like, the main reason we're doing this is to meet all of you and to form relationships and try to help you guys through there. It's like, it's not because of the money and, the course kind of pays for itself, but it's more about trying to give back. And we felt that the course was kind of the best way to do that. But yeah, those guys are great because they're all incredibly normal people. We love beers and meeting people. And a lot of the connections from the last few years have, that I've helped people out with their study groups or they stay in touch. And the thing I've realized as I get older is our world is so small and it only gets smaller the longer you're there in a really good way, right? You get, people, or at least have 1 degree of separation, but it's kind of a beautiful thing.
It is. I really felt that way too. I was glad we got the photo too before we left.
Yeah.
Something while we're on the topic, that group, your group, is putting out a textbook coming out. Give us the date. The new oral boards, textbook.
Yes.
To study
Book
for
2.0.
the new. So everyone knows.
Probably, I would anticipate March to April-ish. We're about 85% of the way through all the final edits. And so we're putting in the grind on, Sunday nights and weeknights to, go through and, heavily make sure that it's the best product. But I'm so excited because the first book was excellent, but this one is, I don't know, 30 to 50% better just from the amount of new stuff in there and the updates and everything. One of the things that I learned when I did my textbook was that it takes so much more effort than you think to create something out of nothing, right? It's just like, you'd be like, oh, I just need to write like a 10-page paper. But sitting down, conceptualizing it, doing it, and then editing it, it just takes a lot longer than you think until you're in it.
Yeah.
And a similar process, right? It's one of those things that feels like a never ending task, but you hope it's going to help people. And, especially because we know a lot of residents use it as a study guide. Like, we want it to be not only for somebody to crack for boards, but I don't know if it was at your program. I'm curious. When I was a first year resident, it used to be that like oral surgery secrets was like the Bible. But I thought it was difficult because it was so choppy. Not that it wasn't a good text, but my hope is that like younger residents can pick up the Blue Book and at least give themselves a foundation to then, talk about certain things, learn more about different things. Just one of those kind of resources as well.
Yeah. Oh, and that's completely correct. Oral surgery season. It's a great book. It's a great book. A couple editions there. Abu Bakr, VCU, those guys didn't land. Yeah. The thing I like about the Blue Book is exactly what you said. There's like quick facts. The big long answers of secrets, they should have kept it to maybe bullet points, and sometimes they did. But some of the answers are, like I'm plugging the Blue Book into either ChatGPT or Grok, depending on the chapter, and then I divide up the question answers for Quizlet, then I put in there and I'm studying Quizlets, and then I'm also having it read it out to me in the car, like quiz me as I drive to work. I was telling you about that. And so people listening to this episode, but here's the thing, like Dr. Jenzer, this, in that first year out of residency, you're trying to get used to practicing. You're trying to fill up your schedule. You're trying to meet new dentists in there, referring. And now you're trying to study on top of that while you have all these life responsibilities because you got to pay the bills, you got to pay the rent, you got to pay the car. And it's very difficult to find time to study. Like, it's very hard. It comes out to like 30 minutes here, maybe an hour there if you're lucky. So it's like just finding the little inches here and there in the car, inches like on your way, I don't know, the plane to North Carolina or St. Louis. But anyway, that's just one topic. But I wanted to segue into another big thing about St. Louis is you get to meet everyone all the authors of the Blue Book are basically there. And you're not going to get that at the other courses. You're going to get excellent experience, knowledge, practice in at the other courses. But that's something I want to give a shout out to about the St. Louis course. And you're there too. You're going to be in the new book. I'm pumped.
I appreciate it, man. Yeah, it's super important to us. That's why last year we started having a happy hour. That explicit purpose. And, we're thinking about maybe doing 2 nights of happy hours next year. But the more we can do to encourage that, because that not only the practice, but the other great part is getting to meet people like we talked about. So we're trying to grow and encourage that aspect as much as we can, because that's what I wanted from courses, right? And so that's what I feel reasonable that other people do as well.
I think it's a great idea. The happy hours are a great way to kind of come back and just chat, just like you said.
Relax. No fun.
Yeah, and those are long days. So having a happy hour at the end of the day is kind of like, all right, I'm looking forward to whether it's 5 or 6 o'clock or dinner at 7. It really kind of, and it breaks it up because then you go out and get dinner with whatever your group is. And that's necessary.
Yeah, for sure. I'm just really glad that, because those guys all either practiced there or did the fellowship. So I was just lucky to have a mutual friend, Dr. Joe Ivory, who was in the military with me and is now retired and is practicing. But, I was kind of the odd man out. So just super lucky to be able, it's funny how life's little confluences get you involved with people that, you wouldn't otherwise normally cross paths with. So I would say most of my life has been a series of happy accidents like that, which, I think a lot of us have a certain mentor or just happen to meet somebody and a door opens that you didn't even know existed.
Yeah.
It's why I think planning for the future is so hard more than a couple of years out, because then life happens, a curveball happens, and then you got to adapt to it and kind of, or hopefully a good new opportunity that opens a door.
Right. There's always a curveball. There's always something that comes out of left field that you didn't anticipate. That's for sure. Hey, and speaking on the track, you said how, life has a interesting for viewers. And actually, I don't know where you went to dental school specifically, but can we give just a trajectory of dental school to residency to the other program? You did something in between and you're in the military, right? And now you're program director. Just, can we go from start to finish just so listeners, myself, I know most of it, but for listeners can get a trajectory of, where you came from, where you're going.
Yeah, absolutely. I grew up in a small town in Vermont. And then I remember I was in middle school when 9/11 happened, and it really struck me profoundly. And I always thought that if I could give back to the country and help prevent things like that from happening, that would be a worthwhile way to spend my life. And I got an Army scholarship to go to college and went to Boston College, and then got another scholarship to go to dental school and went to Creighton University in the Midwest. I never the only thing I knew about the Midwest being from New England was like cornfields and Field of Dreams. But then I found Omaha was an amazing city filled with really wonderful people in the Midwest, and it was cheap to live in. And Creighton didn't have any residencies, so I was like, great, I get to get all these skills and be a really good dentist when I finish. And then I had a surgical mentor there, like, who invited me to the OR to do a gunshot wound as a late second year. Dr. Jason Untrauer, an amazing guy who's staff at University of Nebraska Medical Center. And I would not have been exposed or become a surgeon without him. So we always hang out at AMIS, and, he's one of my longtime mentors. And then I was a dentist for a year in the Army. I really like most of the military docs, show up and, you just do your job. But they don't really expect much of the military stuff from you. I really enjoy that aspect of it. So I've gone to paratrooper school. I've done air assault school, like rappelling out of helicopters and doing that stuff. This spring, I spent 5 weeks in the woods helping to run something called the Expert Field Medic Badge with the 82nd Airborne. So I really treasure those moments. You get to be out doing really cool things with amazing people. I feel like that's one of the main things that separates us from, private practice oral surgeons. So I try to embrace it. And then did my training where I'm now the program director, actually, at Fort Bragg here in North Carolina. I got really lucky. Another door. I happened to go to Dr. Dave Powers' trauma course. He runs one at Duke every year as a chief. And I was like, this is incredible. This guy's, I've read his papers, but got to meet him, and then was kind enough to link up, applied for his fellowship, and then was able to go do that. So just a series of happy accidents, man. But yeah, I can't complain. I love my job, training residents, and then doing, taking care of folks in the military and their families and veterans. So, I think we, in our profession, right, you can make a good living, whatever you decide to do. So, I kind of found that and thought about it later in residency. I was like, I really love teaching and doing bigger surgery. So like, I should just follow my passion and do this, because if you love your job, then, I think life becomes a lot smoother and better.
Everything falls into place from there. That's right. It was at Duke where you did the trauma fellowship with Dr. Powers. That's right. Right. That's who it was. Okay. I was like North Carolina, but I forgot it was Duke. Got it. Yes. Yeah. And so everyone that doesn't know, as far the paratroopers, but your background is that you jumping out of that helicopter? On your computer background?
Yes. Yep.
It's something we can't show, but like I think that's such a sweet photo. That's something I would never do. So like, that's awesome. Thanks. And paratrooping, that's not just helicopter, it's planes too, right?
Paratrooper school or airborne school. If you've ever seen like Band of Brothers, is jumping out of planes. Yep. What's
your favorite war movie or show series?
Yeah, the OG Band of Brothers, about the Europe campaign, is definitely up there. Probably a lot of the similar ones. I feel like there haven't been that many good ones that I've really enjoyed recently, but like maybe it's some of the nostalgia factor or the impact that it has on you growing up, but like Saving Private Ryan and a few others. But Band of Brothers is really accurate, and they went to great detail in getting things right. So that one in particular, I think, really struck a chord with most people in the military.
Oh my God, that's my favorite. In fact, one of my family friends, almost like cousin, same last name, but not like a part of it. He, I think that was his favorite growing up and everything. And he went into the Marines and did all that. So nice. It left an impact on him. It left an impact on me. I love the music to that too. Sometimes I'll just go and like find the soundtrack. It's an epic show.
It just gets you fired up when you hear that song.
Yeah, that's a good. If anyone's listening, you got to watch Band of Brothers. It's outstanding. I've seen it, I think 3 or 4 times myself, maybe like 4 or 5, honestly, at this point. But yeah, that's a good one. Was that an inspiration? Did you see that before or after? Did you go to paratrooping school? Did you get training in that?
Yeah, it was a long time ago. It was when I was in college, so I think I went in 2008. But yeah.
Were you jumping out airplanes too?
Yeah, I mean, I can't pretend like it's, the course itself is 3 or 4 weeks. But it's a very cool experience. I was second guy in the chalk, which means that somebody else was the first person in front of me in front of the door. And, this was a while ago, so things have changed now, I would imagine. But they told us before, like if you freeze or you stop in the door and you don't jump, it can actually cause really serious injuries because things get bogged up and then lines get tangled. So like if you freeze and it's not in an unsafe place, then you can quit and they'll kick you out. But if you freeze at like a improper time, then they'll do what I watched happen right in front of me the first jump. The guy froze at the door, so the drill sergeant like kicked him out of the plane, just boot in the back, and he just. I was like, "Oh my God, I'm jumping!" That was a really cool experience.
That is wild. I would never do any. So just coming from my standpoint, I would never do any skydive. I would never want to jump out of a perfectly good airplane. I think if it was I don't like airplanes in general, so I would never jump out of one. But yeah,
You should try it sometime. It's quite an adrenaline rush. There's few things that compare to it in life.
I get enough adrenaline when the planes hit a little turbulence and they start to go like this. I'm like grabbing on the person next to me. I'm like, yeah, no, that's not good.
Can
But
we all take this a little bit, please? Hey, no shame, man. We all have our things, right? Yeah, that's fair.
that's my thing. That's my anxiety goes through the roof on the airplanes. But the band of brothers when they're getting shot and then
Yeah,
like one engine gets hit and they're all jumping out of the airplane. They're like getting lit on fire because it just for
yeah,
you to be able to do that and not be getting shot. I don't know. It's all just
yeah. The amount of like really really difficult, crazy things that so many folks have gone through us beforehand. Sometimes gives you inspiration, right? Like they can do this. Well, I can survive one more day in residency, or it's going to be okay. I'm
yeah.
tired. I haven't had a lot of sleep this night. We're on call, but it's all right. We'll be okay.
That's a great analogy too. And while we're here, it was Veterans Day. What is this? A week or two? This is like a week or two ago, right? And so yeah. Also, I want to throw that in. Shout out to you. Thank you for your service and being a part of the military, and then staying in it now. And now you're teaching the next generation. You're also doing on the side with mentoring, but also you're doing it directly. You're in your program director. I mean, you're in Fort Bragg. That's incredible, incredible. So I'm not trying to like toot your horn too much, but I do need to give some appreciation to everything that you're doing because I like to see other people kind of follow your leadership and follow like actionable stuff to help and give back. So yeah, let's transition. Let's chat a little bit about. I thought St. Louis was fantastic. North Carolina was excellent. The LSU course a little bit longer, right? That's a week.
Yeah, LSU and Denver are very similar in that they're more of the comprehensive oral courses. They're 5 to 6 days each, and they cover everything, mostly with just really in depth lectures. Like they're very focused more on that. So for residents, I always recommend trying to go. I usually have my second years go to one course to get exposed to the breadth and see some amazing people lecture, and then go again as a chief because it's good for like written board review, like nuance and detail for everything. But if you're preparing for the oral board examination, I think it's a little bit too broad. It's certainly not bad if you need more of a base. But really, as you know, like the crux of oral boards is speaking and practicing and
Yep.
focusing. I think about more of like St. Louis and the Rising Technologies course with FOM and Charlotte as those oral board focused courses, and then written. And that might be a simplistic, thing and just how I view it, but, for LSU and Denver. But they're great courses. The chair at LSU is I'm lucky to call a good friend of mine, Jeff James. Him and I worked together at Augusta for 3 years, and he's part of the St. Louis crew as well. But he's been one of my mentors. He's an incredible guy and surgeon. If for folks who don't get to spend a lot of time in emergency, he's got a rare gift of being a visionary. He sees in really big picture, and then like, how do I improve entire institutions in a way that most people can't figure out or we get stymied very easily. So I got to work with him and see how he did that for 3 years, which hopefully helped me now shape my own residency in my own space. He kind of is really revitalizing and making the LSU course amazing. It's kind enough to invite me to, talk about medicine and anesthesia there.
And who was that? Was that Jeff James or was that someone
Jeff
else?
James, yep.
Really, really, really. We got to get him talking or speaking or giving some ideas for
Yeah.
the 6-year residencies. I talked to Dr. Corestria last week, and we are talking about how the last 2 years has been a little bit of
Yeah.
dip of those unmatched spots. I'm a 4-year guy, but we're a team here, and I have a lot of ideas. I mentioned on that episode, and if he can think broad scope like that, because it's going to require a lot of ideas, like quantity, a lot of ideas, but also some qualitative ideas where it's like, okay, we can't just go out and mentor more people. We need to actually give them some like tangible reasons why. Like we got to create those tangible reasons why that 6-year program with the MD is going to benefit them.
He's a great guy to talk to because he's super knowledgeable about. And I don't know if you've heard it or if you ever heard the name. There's a friend of mine named Mark Engelstedt who's the PD at OHSU out in Oregon.
Engelstedt, yeah.
And he's an amazing guy. But he did an episode on teeth and titanium where he actually wrote a Substack and it's like a mini dissertation on this exact topic of 4 and 6 years and the pros and cons. And I recommend everybody who's thinking about it to listen to it because he very clearly goes through it more eloquently than I've ever heard anybody break it down before. But yeah, either Jeff and or Mark would be amazing to get on to talk about that more too.
I'm going to have to ask them to get on. Also, if you, at some point, I don't know how busy you are. If you could forward me that episode too, I want to listen to it. I want to hear the whole thing. Cause
really, listen to that part of it. It's incredible.
Yeah, we're all constantly learning, and I get a lot of people, whether comments are talking to me about how, because I'm obviously biased. I did the 4 years, so I'm advocating for the 4 year because I want well, I like being a 4-year oral surgeon, but I'm also trying to mentor from the fact is like, you need to find what you're looking for. If there's a pre-dent, listen to this. If there's a dental student listening, you need to find what you're looking to get out of it, and then kind of reverse engineer. All right, which direction do you want to go? So that's my little spiel on that. Oh, I'd like to get that content, but
I'm a 4-year guy as well, but here I am teaching medicine and anesthesia at a lot of different places. So I really think it matter. One of the things is you can do whatever you want once you're in it, right? Like you can take it as far as you want to go in terms of what you want to publish and teach and be an expert in, once you're in residency. So you don't have to be constrained, that even if you don't have an MD. One of my obviously I'm nerdy and like school stuff. So one of my dreams is that like once I retire, I can go back to med school and be like, I think I'd be a really good med student at the age of like 55, like doing my anesthesia rotations and stuff. We'll see.
I could see you doing that.
I don't know if it'll be financially viable with my family at that time, but it's a dream.
They'd probably give you an honorary degree at this point, right? With all the work you're putting in out there.
Trying to knock out those
crush that
exams.
I'd actually like to see this. I'd like to get an idea of this. I'd like to see you be valedictorian and you're like 65 years old or something.
I think it'd be pretty funny. Might be just worth doing it for the laughs.
Yeah. And so your wife is an ED doc, right?
Yeah.
Yeah. So a little bit of the medicine there, right? Where did you guys meet? Can I just get a little insight on that? Get some little bit of
your home place, man, in New York City on New Year's Eve one year.
No way. Oh, wait. I think I heard this. Give me the story. Was it a bar? Was it at a what?
I married up. She's much smarter than I am. So she worked on Wall Street for 6 years doing finance stuff before going to med school. So she worked with some of my friends from college. And so we met there in New York City. But yeah, she was doing the finance thing and doing really well at it. Both her parents are docs and knew she eventually wanted to go to med school. So then she eventually left that world and did med school and residency down here at Wake Forest. So we weren't too far away. I was finishing up residency when she was in med school, and then most of our relationship, we lived apart I was talking to somebody else in the St. Louis course who was in a very similar boat. And I know there's a lot of us in that where, especially if your spouse is in medicine or even some other oral surgeons, then, you have to live those years apart. I think it is easier in some aspects when your spouse is in the same situation of like working super hard, because then you're both supporting each other, seeing each other a couple times a month, but you understand what your spouse is going through. So, when it's right, it's right. And, it always felt fine, and, we made it work. So it's nice. We finally, we're able to live together as of 2 years ago now. So, we've been together for a long time and married for a couple of years before we finally lived together full time. So thankfully it worked out well.
Lord.
Yeah.
You didn't live together like for an extended period of time until after you were married?
Yeah. COVID was a couple months, but we moved in together 3 years after getting married when I finally finished fellowship and she finished residency. Yeah.
Man, that's a long route, but yeah, thank goodness it all worked. But like, it sounds like
I was a little worried. Yeah. But thankfully
it could be a little concerning, right? And then you have a kid now. So you guys are about the same age, right?
Yeah. Yep. I just turned 36 and she's 35. Yep.
Oh, great. Easy. So, I one touch on the relationship thing. I get asked about this every so often. It's great when you're in a similar field. I mean, whether it's law, whether it's medicine, dentistry, somewhere along the sorts. It's also great. It can help if their parents or one of their parents was in dentistry or medicine. You said that her parents were doctors, right? Physicians. Yeah. And so she knew what she was getting herself into with you. And then she always knew she wanted to go back to medicine. Get yourself, as in like just the time consumption. We constantly get pulled to this profession for years and years and years. And if someone is, say, solely in banking, solely in finance, and didn't have anyone in the family, it's going to be a lot more challenging to kind of be on the same wavelength as that if they have known in the family in this career path,
Hey, man. Yeah. And like my brother who's finishing up his HEMONC fellowship. We don't have any medical people in our family. He's not in the Army, but we have no military people either. So we just kind of fell into this. Yeah. But it was making me think about, like, during dental school, how many of my classmates had parents who were dentists, right? I feel like it was more than 50%. It was a ton. Are your parents in medicine or dentists or anything?
Nothing. Nope.
Cool. But yeah, so many of them were like, I'm going and joining my dad or mom in their practice afterward. And it's surprising. I guess it's hopeful for the future, about my daughter now and, your eventual kids. And if we have any more that, maybe it steers them a little closer on a path where, hopefully, we were talking recently about like AI and jobs and how there's a concern and everything. What's it going to look like in 10, 20 years? And I'm like, well, I don't think the medicine part of it, or at least certainly not the procedural parts, will go away. So, maybe that's
Who's we? Who's we was you said we were talking about? Who's we?
my wife.
And what do you think? Wait, no, I'm curious now because I want to hear this.
I mean, it's hard. I'm not sure. I'm more of the camp of like, I don't really stress about things that don't affect me directly.
Hmm.
Some folks will get really like stressed out reading the news or seeing world events where I'm more like, I like to generally understand what's going on, but I don't let like, make it hard to sleep kind of thing. So
Yeah.
I'm like, hey, we'll see how it shakes out and, make the best of it as it gets there. Hopefully it's good.
I think
Hopefully it's not Skynet and, robots everywhere and that kind of stuff.
Yeah, that's going to be interesting. If that it's probably going to come sooner or later, but hopefully not. Like you said, taking our whether surgery or dentistry or medicine too far away from us. I have the feeling it's going to be more adjunctive. I really think it's going to
I
be
think
very
so.
adjunctive.
Yeah.
You know what I mean? Like bariatrics, they're using the Da Vinci, that big spider
Yes.
looking robot for bariatric surgeries of the stomach. If anyone's listening and doesn't know, but you still need a surgeon to operate it. It's
Yep.
not doing it on its own. So I think there's a lot of concern with AI and where the jobs. I think it's going to make a lot more jobs with electricians, but like it's going to be more adjunctive, and I think it's going to be how we learn to utilize the AI rather than being afraid from it, or like because there are a lot of teachers out there that are like, no, I don't want you to use anything. I think it's you need to learn how to use it. You need to learn everything fundamentally yourself, but then learn how to use that. And
Absolutely. There's so many parts where I think once it like fully gets integrated, it'd be so much better about like an initial read on radiology to help you not miss things. I haven't experimented with it all because in the government system we're a little constrained, but I have a lot of oral surgeon friends who are experimenting with the AI scribe technology and have
yeah,
found it to be incredibly helpful. You have the conversation and the long, TMJ eval, the 30 minutes you spend, playing therapist and listening, it documents all that. So you're not having to spend so much time writing an essay, and then your notes are much higher quality. So things like that, I think have you messed around with that at all, or your practice use it at all?
I heard of that one. Just this describe technology in AI, but there's a couple apps. I was using
Yeah,
Care Notes for a while, and then I realized that I can really just kind of get the notes in between every couple of patients. But yeah, those are really good. I think they are really good and help you not to miss things, like you were saying, how it's listening in on the convo. I think that could become it's good. I think it's really good, and that's a start to it. There's just so many dimensions AI will go that'll be better. I think that could be potentially illegal. That might be a little legal issue because does the
yeah,
patient know that there's AI listening to you, and then where's the data within that AI going?
that's a good
Is the
point.
company sending that all that patient information? Because they're doing stuff on the back end. That's one thing I'm a little concerned about. But what I'm not concerned about is I'm really interested in seeing receptionists, like AI receptionists, not literally sitting there at the desk, but someone actually receive like an AI receiving phone calls that has databases of patients when they call in and just kind of remembering like, oh yeah, and what about little Johnny's soccer practice? Is this next appointment going to conflict with that? If you have an AI bot that can kind of receive phone calls and stuff and then call them, remind them of their cleaning in 6 months, AI is really going to be in that space. I'm interested in seeing the company because that's something I would invest in. I would use it in the office every day and I'd
Yeah.
invest into. But anyway, for
I
another
don't
time.
know if you've ever had a chance. I went to, AO, the big
Yeah,
organization that runs a lot of courses. They have a series of advanced courses, which are incredible. Like Dr. Powers runs a ballistic one every year, and I went to a bunch as a fellow, and they were some of the best courses I've ever been to.
Hmm.
Usually, like a mix of amazing lectures and like the faculty ratio for full cadaver labs for doing all the craziest procedures is like one faculty and like two people. So, like, awesome.
Yeah.
And one of them was on advanced technologies. And this was maybe 2, 3 years ago. But we did a lot of stuff looking at not only virtual reality, but augmented reality in the oral surgery practice.
Hmm.
And a couple of the really cool things that I were even available at that time. And if I was in a private setting, this is like what I would do. You put on the augmented reality goggles along with your patient, and you pull up your VSP plan in space, and you can use your hands to make it the size of the room and spin it and play with it and show them all the moves. And I was like, yo, that's both
Wow.
people can interact with it. Very, very cool. And then I know spinal surgeons are using it right now, the augmented reality goggles in surgery to like overlay the fusions of the MRI and the CT scan to see where the spine is where they're operating. And so it hasn't obviously made it to oral surgery yet, I don't think, but wearing something like that in the OR to show you what's going on underneath and you can cycle
With a
between the
nerve.
soft tissue and bone, like pretty
Yeah.
cool. And I'm very curious to see over the next 10 years as that gets like, more commonplace and the cost comes down, or maybe it's like augmented by AI in some way, but
Hmm.
like surgery might, there might be a different aspect to it or different resources that we have to get better outcomes. I've certainly spent a lot of time chasing bullets in weird places. And even with like brain lab and full CT tech, those things move around a lot. And, some weird stuff like that, I could imagine weird circumstances where it could be really helpful in the OR as well. So I am very curious to see, hopefully to become somewhat mainstream and, accepted in hospitals where it's like, oh yeah, just grab the goggles for this one kind of thing.
That's such a great idea, grabbing the goggles for that. Imagine, say, I don't want to shout out to the companies, forget them, but you know how we put the VSPs up on the wall and then we're looking at, okay, what's the, from the inferior aorta to the nerve, where is that? What if you just put on the goggles and it's like, I could see, so I'm going to cut up to this point and no more.
Yeah.
That would be, this is, give us some insight here, what we need. That'll be huge.
There's already smart people thinking and working on it. So like I said, I mean, I was wearing these 3 years ago. So I know it's happening. It's more of a matter of time, I think, as opposed to like, can we do it at this point?
Yeah. Oh, man. And then looking at cancer, making sure you get good margins. Oh, if you could just put on the goggles and look through them at the patient, on the table, you're right. Oh man. And then the access, we're constantly like expose all the fractures. And then you do the thing. The exposing is always like the soft tissue where the access and visualization of whether it be the wound or the bullet, finding the bullet, that could be putting on goggles and just knowing where everything is would be huge. That's a great point.
Yeah.
That's a great point. So, hey, let's get into some surgery now. I got a couple comments. This was, I don't know, a couple months ago, and they wanted me to go into a little more surgical stuff. So,
cool.
What are some of your favorite? I don't want to get too far into it because it's like end of the day, I just really want to chat. But actually, what are some of your favorite surgeries? I know we went over some trauma. That was at the Charlotte course that we went into. What are some of your favorite surgeries as an oral maxillofacial broad scope, though? I'm curious.
Yeah. I really like doing a lot of different things. So I do really appreciate that aspect of being in a residency. In general, some of the things that I really prefer to do, I love doing orthodontic surgery. I think we do a ton of it in the military and just, we train it and do it constantly. So I really appreciate doing that. I do full scope TMJ. I've been doing a lot of arthroscopy recently. I'm still not good at it. I have a partner who's very, very good. So trying to get better at that. But I really I think orthodontics and trauma are really my favorite. I don't know. A lot of people hate trauma, but I love the complex problems and,
puzzles.
Yeah, puzzles, and nothing's ever quite the same. There's always nuance. You have to know all the things to then make the creative decision making. And you're really helping somebody out when they're at their worst. So I really enjoy that. Complicated recon, I don't do micro, but I love working with teams. I really enjoy multidisciplinary care. So working with other specialists to try to, improve a patient's life is really, I find that very fulfilling. And it's, you're working with other folks. I really like that team dynamic. Obviously a lot of things in my life point to enjoying being on a team or a team environment. So I really like that. But I certainly don't mind all the other things, right? A couple days taking out teeth here and there are totally fine. Bailing out residents when, teeth stuff go awry. I was trained in full face cosmetics. I had a few staff who did that. And I really kind of backed off the last few years, but I recently we've had a run on functional cosmetics. So I'm doing a lot of blephs and brows and, things like that. So just trying to, stay diverse and, mix it up. But what about you? I'm curious.
My favorite procedures right now?
Yeah, either, from residency or, what you're doing now, or did you have areas or things that you really prefer or things you like more or not?
Yeah, I really liked, I did find trauma to be a lot of fun. There's also certain areas of trauma, like when you go too far north, I kind of like to be right around this region, reconstructing from, infrared ribs fine, but yeah, reconstructing from either the top down, bottom up. I really enjoy that because it's like you said, everything's different and you're putting back together a puzzle, which is what I was like, and how there's certain times, for whatever reason, maybe it's better for a top-down approach or it is better for a bottom-up approach, which is and then just kind of explaining that. I'm finding that how you were saying, on the exams, talking through things are important. But we were talking about at the Charlotte course how kind of giving a little explanation for why you would, do one or the other. But, I'm still waiting on hospital privileges, and I actually haven't reached out since the St. Louis course. But I don't know, on Long Island, it's kind of, it's a side note, I know, but it's kind of, I don't know. They want you get hospital privileges. Okay, so you got to take call for the hospital you get privileges at, but they're not going to pay you for the call, and you have to pay for your application year after year to have hospital privileges. So, that's a big predicament for me. It's so you have a child now, right? Now you're going to leave your child who needs to, you need to be there for at 4 a.m. when she wakes up, she needs a bottle or whatever it may be. And now you're going to spend time in the OR and you're not even going to be compensated for it. So you want to help the patients, but now the hospitals aren't supporting the providers. It's something I got to look further into, but that's going to be a resistance to furthering trauma and stuff. But my favorite stuff, I really do enjoy dental alveolar. I mean, just the basic bread and butter, teeth titanium, it's,
Yeah, absolutely, man.
I enjoy doing it. I like looking at the wisdom teeth, especially as like those smaller puzzle pieces, and everyone's going to maybe not all come out different, but those, I'm really trying to get in touch with general dentists in the community because I'm trying to bring together the dental community of Long Island. It's something that I have a goal to do because I'm from Long Island, like from this area, and learning how they like to restore things. And I'm noticing a big trend, especially in this New York area. A lot of general dentists like to work with periodontists, which is fine. But I'm noticing periodontists don't like to work or mention or support oral surgeons at all. And I'm like, no, they have excellent things and they do. We have excellent things we do. But hey, I'm saying right now, I'm seeing, especially with certain parent, it's a one-sided collaboration here that I'd like to see a little bit more of a bi-directional kind of collaboration there. But and I think it's implants where we got to do it. The whole implants and oral surgeons is a whole nother topic. Put up a post the other day that about implants, and there was a lot of things where it was all periodontist favorited, but yeah, that's maybe a topic for another time, but because it's a big can of worms.
I've because I work part time in a private practice right near my house, and
How many days a week? Wait, I want to hear about this. Yeah.
yeah. So in the military, if your commander approves it, then you can take a vacation day and go moonlight, and it's really helpful not only to supplement the income a little bit, but to make sure like I can still perform at a private practice level and keep my skills up because most of the time I'm either supervising or bailing people out as opposed to running a full book myself. And a lot of the basic skills that we emphasize, I've tried to bring to private practice, and most of it just involves communication, right? Like, hey, thank you for the referral. This, sending them the biopsy results, sending a letter back. Hey, for your records, here's what it was. We'll track it, or only send them back if there's an issue. Doing my implant plans, sending them to get approved by the GD. Hey, you happy with their restorative position? Getting their buy-in before we just throw an implant in. Yeah. I think a lot of the issues can be alleviated by just communicating. Pretty much for all my med consults, I write a few paragraphs and then send it. I don't just do the sheet that's like, please clear for surgery, right? I'm like, hey, these are all the disease states that I understand. Here's my understandings of your guidelines and risk stratification. Here's mine. Here's what I think we should do. What do you think? Because you end up with a better result for the patient. And it takes a while. It does take time and effort. I think I worked a couple of weeks ago and I think I wrote like 10 consults, but like, I just think it leads to better patient care. So
yeah.
Like, as everybody's either on, a DOAC or, has, previous cardiac history in private practice or something.
Everyone that finally makes it to us. Yeah. It can be a lot of that at times with the medical history. And you're 100% correct. It's better for the patient. And two, I really think this endeavor is led by communication, connecting the doctors together, whether it be on the medical side or just us on the dental side or, vice versa on the surgical side. Yeah. Communication is, I think it's overlooked fairly commonly.
And I think you can boil it most problems down to, communication. You improve that and you have better relations and better communication about patients, then most of the problems will go away and get fixed.
Right?
I mean?
Right. Yeah. Let's over communicate rather than under communicate, especially when it comes down to patient care, right?
I would imagine it's a very good practice builder too. Like, it sounds like you're spending a lot of time and effort, enhancing your communication and putting in that face time up front and meeting those people and, making sure that you are available to them if they have issues, if they have questions, and trying to build those relationships.
Yeah, I am. What are some of these tips and tricks and kind of like characteristics, if you will, qualities in surgeons that you're instilling to your residents? Here's one.
I think, so I assume from our previous war talks, you've heard the term Rangers, like the Army Rangers or Ranger School. Yeah. So one of the people who trained me, was a very influential NCO, senior E7, a sergeant first class. And he had spent his entire career in the Ranger Battalion as a sniper and on some far-reaching reconnaissance teams. And then he was a Ranger instructor for 3 years prior to, me being a young, just out of high school kid he got to mold. And he was one of the most professional, badass people I had ever met, right? Incredible. But, so he wore his, his ranger stuff, right? And you get to wear a special tab on your arm if you've been to ranger school in the past. And it's ranger school is really hard, right? 60 days with very minimal sleep. You usually lose a huge amount of weight, and it's really, really, really difficult. Yeah. And he would point to that, and he would just be like, Jenzer, like this tab that says ranger here, it just gives me the right to outwork everybody else. So that's the kind of thing, that's like a lesson that I tell my residents. I'm like, the fact that you're a surgeon, like, doesn't mean anything, that you're here learning. You can never stand on your laurels. You're only as good as the last thing that you accomplished. And the fact that you're a surgeon only gives you the right to work harder than everybody else. Because if you can have that mentality as you approach it, like you're probably going to be successful. And we spend a lot of time talking about communication and reviewing things when communication leads to failures. And it's funny how much of this, boils down to we got to communicate better and make sure people feel heard and seen and listened to. We communicate what we do back, because I remember being on the other side as a dentist and being scared of the oral surgeons and being afraid to send them things, or hey, I don't know if this patient has an infection, but I know I don't know, and it's scary. Like, can you look at them? And you never want to feel dumb. So welcoming, no problem. We'll take a look. When they send me, you get a lot of the consults for path that are just like, little radiopacities, right? Or, cementoosseous dysplasia. And you just kind of watch it and monitor it after discussing with the patient. But I always reach out to the dentist afterward. Hey, great catch. Thank you for sending that. I think you're doing a really good thing for the patient. Again, like we said, trying to build that teamwork and rapport within the dental community. Make sure that they will, because, if they're scared of you, then they're not going to call you when something's really wrong or miss something potentially.
Right. Yeah, especially since we are kind of their point person for pathology. They don't usually send things to pathologists from what I can see. And that's fine, because it's like there's the delineation, like what do you send and why. I got a biopsy today to a consult for one. And it's, that communication with the patient too, especially with when it comes down to pathology. But yeah, no, that's really important. For any of the younger oral surgeons, actually, and I've gotten some feedback from people, some general dentists are liking the younger oral surgeons than some like the older, which is what you just said. Like sometimes they're afraid to talk to some of the older oral surgeons, some of the more experienced, yes, but the communication can seem a little bit, I don't know if it's like condescending, but anyway, there's hesitancy, right? Good news for younger oral surgeons, people are liking to work with younger oral surgeons. I don't know what it is with the residency experience, but so that's some really good feedback. And I know oral surgeons graduating under your supervision and training. Yeah, no, really, because you're instilling these important fundamentals.
Yep. I wouldn't sign their certificates if I didn't have my full trust and confidence. And I've been super lucky. I have amazing residents, and we have an amazing team. Because as you know, if you don't have a good team in a residency, it can be really challenging for both residents and staff. And I'm so lucky that I have just wonderful people. I think probably a little bit more so than civilian. We spend a ton of time trying to develop them as both surgeons and leaders and officers. And the military is really good at that. We're really good at developing leadership and officers as we go through. So we devote the same amount of time and attention individually during their surgical training at every point. So I hope so. It's my heart and soul. It's, my purpose of existence in my job, and I love it. So I think you can really tell if somebody loves what they do pretty quickly, especially when it comes to education, or if they're like, oh, I just got to do this or staff this. So my hope is that comes through, and that, residents appreciate that. They tell me they do. I don't know how much they do in the moment, but when we're doing academics every week and we're doing mock boards cases and, going through material and pre-post, but I know they're going to be better service for it.
And in hindsight, they're going to be like, oh, thank God you took the extra time. Thank God you showed me this extra thing and we talked about this extra that, for sure. Fellowship training. You did fellowship. Tell me a little about that. Was that 1 year? Was that 2 years? Was that Duke?
Yeah, 1 year. Dr. Powers takes one person a year, and it was amazing. I actually went after being an attending for 3 years, which turned out to be a really big blessing because I was very comfortable with what I knew and what I didn't know. I'd been teaching at a residency for 3 years and was pretty comfortable with general trauma and a lot of like orthodontic TMJ, a little bit of cosmetics, dental alveolar, benign path. At Duke, we were there's no oral surgery there. It's part of the Department of Plastic Surgery, and they have one of the best plastic surgery residencies in the country, and they're very focused on microvascular surgery. So I was with a bunch of really like the best plastic residents in the country as my team, and I was also half in the Department of Neurosurgery because we did a lot of stuff like you were describing. I was chuckling to myself up here. Cranioplasty reconstructions, dealing with really complicated infections, and Dr. Powers has an appointment in the Department of Neurosurgery, and I wanted to get really comfortable with this. because there's just not that many neurosurgeons, and there's even less in the military. And if we're actually at war, guess where people are going to get shot? In the face and the head. And, you can't just do this and ignore the brain entirely. So I wanted to be really comfortable that if I was somewhere far in the world and it's just me, that I could at least do my absolute best to keep that person alive.
Yeah.
So it was awesome in that regards. But we just operated all the time and did tons of big cases, a lot of those team reconstructions with, resections and flaps and things, a lot of complicated trauma. And, watching Dr. Power is one of the best to ever do it. There's all these tips and tricks that I picked up that were like, they're not in textbooks, right? I'm like, why are you doing it like that? Or, what's your thought process here? He's like, well, I tried it this way for 20 or 30 years and then found that this actually is much better. I'm like, great, that's enough for me. I'm just going to do it your way. Say no more. Perfect. But it was incredible because I got to be a teacher to the, residents, as well as learn from just an amazing group of people. So it was by far the best educational year of my life. If anybody is thinking about it, there's a lot of great fellowships out there, and I would strongly encourage you to, look at it, especially if I wanted to, make sure I was comfortable and with as much as possible so I could be the best educator as possible as well. So I felt like I owed that to, future residents that I would train, that I could, just, how it is. The only way to get good at stuff is to be in the OR a lot, see it, and then see complications and when things don't go good, so you can kind of figure it out.
And develop that portfolio of things well, this didn't go right and this did go right and so on. Yeah, for sure. And, also shout out to St. Louis. Did you get a text? Did they fill that spot? Because next year they're looking for a fellow.
Yeah, I think they're doing some interviews right now. Yeah. So, they expanded up to 2 people a year, and the St. Louis fellowship is incredible. If I hadn't done Duke, I would have, probably gone and done St. Louis. I think I was talking with Aaron. Aaron Figueroa came and lectured to my residency last week. So, yeah, it was great through the SWORD program. And I think he opened a couple hundred joints in fellowship, and then you do a ton of trauma there and nathics and big infections, and also the katana implant stuff. You just get comfortable at doing big, complicated things. But yeah, they had so much stuff, and they have such an amazing program that they're growing, and they expanded up to 2 fellows. But I think somebody found that due to family reasons couldn't do it. So I think they're hunting somebody. So yeah, if you're interested in potentially talking to those guys, reach out to me directly. I'm happy to connect you or them. But yeah, fellowships are, if you're on the fence, I would strongly encourage you to do it. You will not regret it. I promise you that.
I think if I was to do, I'm not going to do a fellowship. I got to start with a family and something. But yeah, if there was one fellowship I would pick, just meeting those guys too, because you're with them most of the time, right? So in addition to the surgery, you need to be doing the procedures you're interested in, you want to learn with. Also, you want to be around good mentors, good people, guys you're you want to get a beer with them too. Yep. That is the program. And I think you would agree. We mean this. I think that's super important, and they're part of the guys that wrote the textbook. All you guys. So now that's a very serious point, and they're going to get that spot filled. I hope they get the person they're looking for.
Yeah, me too. Because like you said, we're exactly what we seem. We're relatively normal people who just love educating and trying to fill the space, but also great to grab a beer with and hang. So.
Yeah. Then that meme, the what was it, the Martin Luther King meme? You gotta have some fun in there once in a while, right?
Yep. Exactly.
I know you got to go soon. So just one last thing. How's your daughter? How do you like managing all of that on top of program director? Now you have one day. I didn't even know you were in a private practice one day a week. You did all these courses, flying here, driving there.
It's tricky. A part of it is having a great residency staff as well, and we all balance each other well and work around each other in a really supportive way. Primarily my amazing wife, but it's nice is in the military we get 3 months of paternity leave now, or maternity for both. It's one of the nice things about the equality stuff. But I didn't want to take 3 months away from the residency. I thought that would be too detrimental to the program, so I'm just taking a little bit here or there, a week at a time. So each of these months, in September, I had a week off. October, I took a week off to be with Sadie. So trying to really spend that time, because everybody says, and she's already much bigger than she was, that it goes fast, and then you past it. So yeah. Weekend stuff. And then with my wife working a lot of myriad of shifts all over the places in ER doc, we have a wonderful full-time nanny. So without that, I think it would be impossible, but because daycare just doesn't work for our hours, so.
Right. And then, so you're from Vermont too. Did your parents come back down there? Are they still up in Vermont? Where are her parents?
My parents are still up in Vermont. Yep. And they're coming down for Thanksgiving this week, so we'll see them. And her parents were in Rochester for a long time, but now live in Charlestown in Boston. Yeah.
Boston.
Yep. So my brother's in Boston. Her parents, yeah, we love going. And I went there for college. So Boston is a special place in my heart. It's a great city.
Okay. Because I was going to say, if they're in Rochester, and they went all the way to Boston, they kind of moved further away from you guys. But okay, you like Boston. Good.
Parents come up and down, a little bit. But I'm starting to understand why everybody says it's much easier to have kids when you have family and support around, for the random babysittings or just need help. So thankfully, we have a great network here and a lot of good friends to, make it work.
Right. And the full-time nanny, that's so important. And I mean, I'm not going to get into choosing a nanny. Some of my friends, they were saying like they go through a dozen nannies before they find someone who's the right fit.
We got super lucky with a kind of a friend of a friend, and it's perfect. So yeah, we lucked. I was a little bit worried about that too. I don't know. Yeah, potentially some issues you'll have to deal with the next few years after you're getting married this next year or next year and a half, right?
Yeah, 2027, January 2027. So
yeah, at some point, we all kind of, but it made me think a lot about my co-residents. A lot of them had kids in residency or had multiple kids or going through it, and how hard that would be on your significant other to do it. That's hard for me to imagine. Most of my residents have kids or a couple of them are having kids this year, but I think it's hard on a family unit, difficult time.
Yeah. It's a tough time to do that. Yeah, man. Yeah. Hey, thanks for coming on today, taking the time. Was there any other? We hit on a bunch of things. Was there anything we missed on? We didn't go into actual test taking strategy or content, but you've done a couple other podcasts. We could always come on again and chat again if residents reach out and they're interested.
If people are interested in a certain thing, or I'm happy to, if what I have to say couldn't be at all helpful to you, please let me know. Yeah, I think that, for everybody listening, it doesn't matter, if you're in medicine, dentistry, of anything specialized or not, like you have the ability to really change people's lives through little interactions or inviting them to do things or trying to be that mentor for them. And if we all can do that for people, then the world becomes a better place. So think about how everybody listening, just think about how you can do that in your day-to-day lives and, try to see, because that little bit of good you put in the world is a beautiful thing.
It certainly is. And I'm glad we're along the same mindset with that, along the same wavelength. So I have a feeling we have a lot more podcasts to go, a lot more courses and stuff. So this is only the beginning, but thanks for coming on. I know we did the first podcast together with Dr. Figueroa, but I wanted to get you, get to know you a little bit more and let other people kind of hear your story a bit too, because it's absolutely fascinating. I'm a big advocate of yours. I am. I'm gonna let you know that. So yeah. Hey, have a happy Thanksgiving. Thanks for coming on again, and we'll touch base soon.
Make sure you wind it down too and enjoy a day of some turkey, football, and cold beer as well, my man.
A lot of cold beers. A little bit of turkey, a lot of cold beers. All right, babe. We'll chat soon. Thank you. All right.